had somebody with a mic not muted there. So let me just start over by saying thank you everyone for being here today. Really appreciate it. I'm sure all of you have heard as of noon today, the governor has announced that the Bay Area region is now falling below the 15% ICU capacity rate, down to 12.9 as I understand, and therefore we'll be falling into the stay-at-home tier order and the associated closures that come with that, namely to restaurants and beauty salons, barbershops, and the reduction of retail services throughout this county and the region. So let me just jump into the numbers. The numbers are, startling. If you look at this, where we were and where we are now, from over Saturday and Sunday, we've had a positive case rate of plus 860, Monday 291, and that was a two-day number on that 860 on Sunday, and then Tuesday at 455. Talking about the testing rates, last week the county tested almost 17,000 individuals through Curative and Verily. 8,400 at the event center with Curative and Verily, and 5,700 at the mobile sites, 3,500 through Curative drive-through at the event center. And that's the family-friendly line that 5 and above families can come through, and then almost 2,700 in Daly City. And obviously the event center continues to process great numbers there. The testing at the event center is held Tuesday through Saturdays at 8 a.m. to 3 p.m. Obviously, given where we are now, appointments fill up very quickly, and the testing of the Curative lane and the event center runs from Monday through Friday from 1 p.m. to 8 p.m. to accommodate families, namely. Talking about our mobile testing sites this week, we've got Half Moon Bay today, the 16th, and then Thursday, Friday, we've got North Fair Oaks, Monday, Tuesday, San Bruno, then Wednesday, December 23rd, Half Moon Bay, and Thursday, December 24th in East Palo Alto. So a little bit more about the regional stay-at-home order. Obviously, we were at 15.8% ICU capacity yesterday, and that has declined precipitously to today. I think that we have, if you look at our numbers, we have, I believe, 9 ICU beds left. I don't know if you can throw that screen up. We can go back to that original screen, Connie, where we can see the total deaths have increased over a period of time. If we want to back up a few slides, there you go. Great, thank you. We look at the total deaths have increased. I believe the last time we spoke, they were at 170, so you can see over a 2-week period where they've gone. It's that continued age range of 20 to 40 that continues to drive, but the area of 40 to 49 is also increasing rapidly also. And really this is because of social gatherings. The Dr. Morrow has indicated that, we saw this to some degree after Halloween and with groups getting together. And then certainly we're seeing the outcomes from Thanksgiving here with a severe spike that we're going through. If we go to the next slide, please. You can see where we have 110 now hospitalized with COVID, confirmed 105, and 5 additional suspected ones. It's clearly the most we've had in the past. We have 9 available ICU beds in the county of the total 71, and we have surge beds, surge ICU beds at 88, and none of those have been utilized yet. We only have 2 from out of county that we're looking at now. So, and the surge beds will depend certainly on staffing, and that fluctuates from day to day. And just to give you a kind of a concept of where we've been and where we've gone to. So where we are today, or as of yesterday, the adjusted case rate is at 17.9, and you think about this from less than a month ago, we were at this 7.6. Even if you go back a little bit further, to 11/9, to November 9th, we were at 2.2 adjusted, and now 17.9. And clearly we're getting the maximum benefit we can from testing. I'll talk about that in a minute. The unadjusted case rate is at 35.9 as of yesterday. And if you go back to just over a month ago, 11/9, November 9th, we're at 4.1. So think about the dramatic increase that's taken place there. The positivity rate is still barely within orange at 4.8, but back on November 9th, it was at 1.3. And then the equity metric is one that certainly jumps out at us as, back on November 9th, it was at 2.5. It's now at 8.7. So that is something that we continue to monitor and something that is continuing to be a concern of ours. So again, what's certainly driving this are the social gatherings. It's something that we cannot regulate. It's something that we can only prevail upon the folks in this county to stop. And it's the only way we're going to get a handle on this. It's the only way we're going to get us to decrease these numbers. And these numbers are somewhat overwhelming when you think about the testing that we're doing. And we'll talk about the testing in just a minute here. But we do have, obviously, the vaccinations on the way for the first tier, and that will be our frontline medical workers who are working on this. And we'll continue to keep you updated on that. In regard to testing, I mean, we're testing at an astronomical rate right now, second in the state at 961 tests per 100,000 people. Compare that with the state median of 362. It'll tell you the volume of testing that we're doing. There's high demand for testing all across the county. I think a lot of people think, well, if I get tested and I'm negative, I can meet with family. That is not the case. That is not the message we're putting out. The message is that it is a point in time, and that in every situation you come into contact with someone, you should feel like you have COVID or they have COVID and take the necessary precautions. That means masks, social distancing, washing hands. And some of those interactions obviously are necessary in the grocery store per se. But we've got to keep our guard up and try to limit those amount of contacts that we do have to prevent the spread and to try to get this back into a reasonable, back to reasonable numbers. So we will continue to test through the holidays here, as I indicated earlier. The business engagement compliance team, we can bring up that slide. We're out there, we're engaging businesses and trying to help them on a variety of fronts, not only with information about COVID, how to stay safe, some of the retail businesses we're working with, the smaller retail business we're working with, but also where they can receive resources, and that's so important. The business compliant unit has now visited 450 businesses. The most common types of businesses that receive complaints continue to be restaurants and retail shop, and most infractions are related to social distancing not being enforced and customers not wearing masks. I can tell you that we have gone now to a stricter phase. We will be citing more, and obviously with these new restrictions coming in place, our code compliance unit will be out there making sure that those businesses are in fact closed, that need to be closed during the stay-at-home period. We will still be out in force through the holidays to ensure that compliance is being met. In regard to county assistance, the health facility numbers and homeless shelter numbers, the AHS Redwood City has 25 rooms blocked, 14 room occupied, and we're seeing a greater demand for isolation now than ever. And those numbers have risen exponentially. We have secured and will continue to secure more hotel rooms for those who need isolation, those who live in a congregate setting, those facilities where they just simply can't isolate. We'll be able to assist them with that. We've got several, almost 100 rooms now blocked off for that. The Bayfront Station has 93 guests, And throughout the county, we've got another 91 guests for a total of, I think it was 185 who are now the homeless being housed in motels right now. I'm sorry, 184. So the Great Plates program, I don't want you kind of bring that up. That's great. Again, this continues to be one of the great success stories of this pandemic. One of the very bright spots of feeding an incredible amount of people who are isolated and can't get out on their own. In the same vein, allowing restaurants to stay afloat and employing folks behind the scene who support those restaurants. It has been incredible, and it has been extended through January 7th, 2021. So we talk a little bit about the county investment. You want to go to the next slide? Now, over $82 million has been invested in relief funds throughout San Mateo County. You can see some of the highlights there: 4.2 million in Measure K, 29.5 in CARES, and 48.2 in leverage funds, which is remarkable. Though we know that this has brought great relief, there is much, much more relief necessary out there, as there's so many people suffering. And I'll talk a little bit about that in just a minute. The Immigrant Relief Fund continues, obviously, with great need. The total clients served are 11,221. The fund is about 85% expended, but still incredible need out there in that regard. So just a little bit here, the Joint Information Center Communications with Michelle Durand will have a small socially distanced media watch the delivery of the COVID-19 vaccine freezers. A major media event there will certainly house that precious vaccine that is so necessary. We're also working with health on communications about the vaccine rollout, which will be imminent. And the regional stay-at-home order, as I indicated, was announced earlier. We'll be getting facts out on that, updating the public, as I'm sure all of you will be also. Community outreach, the Massmobile is still doing a great job out there. Distributed almost 1,000 masks last week, 17,000 masks all told, and will continue to be out there supporting that effort. The public public health messaging, the Office of Community Affairs has created 3 multilingual graphics to educate residents. Can we show those real quick? To educate residents about the surge of COVID-19. So anytime we can get that message out, we are doing that and making sure that we get that to everyone that we can, and in the hands of everyone that we can, through as many different languages as we can, because this will take a concerted effort of everyone if we are to beat this surge that we're experiencing now. And I guess our greatest fear is that with the upcoming holidays, that we'll see this surge on top of another, on top of the most recent surge, which could just be devastating if that did occur. So we're just really prevailing upon people and trying to get that message out as much as possible to avoid social gatherings. Second Harvest flyer is also going out. These flyers are going out through, if we got about 180,000 going out to the Second Harvest. It started on November 30th. They're a great source for us to get out information to people picking up food, and there's more people ever that that need food. So these are some of the flyers that are going out in multiple languages to make sure that everyone understands the message here. The funded partnership, the regional meetings in partnership with Thrive Alliance, the Office of Community Affairs, held its first round of regional meetings with the newly formed and funded COVID-19 community action teams. These meetings will enable regional collaborators along with the county to hear what is happening in our communities in terms of COVID-19 outreach, and as we serve the communities, what opportunities we have. So it's a two-way dialogue. We can hear, the community can hear what we're doing, and we can hear back from the community what their needs are, so that we can assess those and try to address them. And then the The Peninsula Family Services, we can see here the Office of Community Affairs also put together 33 outreach toolkits for COVID-19 team, the CAT team. So here's a picture of our CAT partners using the PPE supplies that are so necessary out there. So with that, I'll go ahead and take on questions. I know one of the questions had to do with staying open, and let me just say this in regard to what decisions Dr. Morrow made here, and I think that he certainly eloquently addressed these in the message he put out recently, that COVID-19 has many different effects on a society, not only the physical, for those physically getting ill, but the many tiers of COVID-19 and the many ways it impacts society. And one of those is through poverty, in closing down businesses, in those folks not being able to make their rent or pay for the basic necessities, and being forced from their home and suffering homelessness. And we know that this is a true outcome. And so from the very beginning, we talked about a balancing act, a balancing need of health, which is paramount to us, the health of individuals in this county, which is absolutely paramount, to the complete economic devastation and poverty that this disease has brought about. And I think that I read the other day that this has forced more people into poverty than I think just about anything that we've ever experienced. And the real health implications of that also. So it's always been about trying to strike that balance with health paramount in our mind, along with our long-held foundational belief here of following the state. And we've been doing that since the early days of April or May, that we have followed the state lead. The state put this criteria in place after some thought of once you get to 15% ICU beds, then you close. That order has been given. We will close by Friday, I believe. I believe Thursday at midnight, tomorrow at midnight, or early Friday morning. We will close down those businesses, and we will enforce that because that is what the state has chosen to do. So with that, I'll go ahead and open it up for other questions. And certainly we have Sarija on the line from health who can really help us on the health side of questions.
If you have a question, make sure to raise your hand or put it in the chat.
We do have one in the chat.
We have one in the chat from Sierra Lopez. What's the demographic of those receiving hospital care currently? At what point will the county begin staging the event center for patient overflow? And how concerned are officials about Christmas gatherings?
Well, let me start with the last question, and then I'll have Sarija talk about the more technical questions there. We're very, very concerned about Christmas gatherings. We are extremely concerned that we'll see a surge in the middle of a surge. We are now experiencing Thanksgiving gatherings, and this should be a real indication to everyone out there what can occur and what has occurred when people gather. We understand that this is a time like no other, and that people want to get with their loved ones and want to celebrate just being together and being healthy, but we want to keep you healthy. And those relatives are unsuspecting carriers in many cases of this disease that are ravaging families. And then it spreads exponentially through those other families. So we, in the strongest terms possible, are asking people not to gather this holiday season, to make it one that, is one of somewhat solitude, and we will hopefully get through this in the near future. We see the finish line in sight. We're just trying to preserve as much health and safety as possible in the process of getting through this. So, Sarija, do you want to answer the more technical questions about who we're seeing in the ICU?
Sure. Hi, Sierra. In terms of the demographics of folks receiving hospitalization, the strain on the hospitals is across the county, all 6 hospitals. And in general, the folks who are hospitalized are those with more underlying medical conditions and more severe conditions that require that level of care. What we're tracking daily is how many staffed hospital beds are available, not the specific demographics of every patient who's in a bed that day, that hour. That gets analyzed after the fact, by reporting on hospitalizations. So I'm going to pause. I don't know if if you're unmuted to make sure I got your question.
I think there was another part, Sarija, of the question.
And then on the second part about the event center, we want to make sure that this is not confusing to folks, that while in the very early weeks, there were plans to consider having a care site at the event center with beds that had been provisioned to the county. We pivoted to redirect resources to the hospitals that are best positioned to have staffing to accompany the beds and the levels of clinical supervision and support needed to really maximize the care that can be delivered to our residents. So the surge plans for San Mateo County are being executed by every hospital in our county, surging upward of how much care they can mobilize at every level that they offer.
So hopefully that answered your questions, Sierra.
We have a raised hand here. Astrid Casimir, if you could ask your question.
Go ahead, Astrid. How you doing?
Hi, Mike. I'm good. Hope you're well. Hi, Srija. I have a question. I'm wondering if there have been any outbreaks in like facilities, any like long-term care facilities, for example. And also I'm wondering about the health equity metric. So that number has risen. So I'm wondering what trends you've noticed around that.
Sri, do you want to take that?
Sure. So in terms of outbreaks or concern at residential care facilities, we do see more concern across settings like residential care facilities right now, and more instances in which facilities are reaching out to us, which we want them to do, because they have staff who have become ill and are not able to come to work, so they don't have enough support to continue to support their residents, and have acted in different ways to be offering as much support as possible, working with state partners, of course, personal protective equipment when needed. And it's very strained right now in many parts of the county. And we continue to urge any facility that's having challenges to contact public health so we can support them as early as possible and assure the safety of everyone involved, residents and staff. The state continues to update weekly numbers on facilities, a different site for skilled nursing facilities, and then other types of facilities that are regulated by the State Department of Social Services. In terms of the equity metric and what we've seen, overall, with this increase in cases that, as Mike described, has followed as we were concerned about after the Thanksgiving holiday, the positivity rate has gone up across the population, and we already had a higher positivity rate in our most impacted communities, our most vulnerable communities. And so as the positivity rate for the overall county and the lowest HPI census tracts has increased, both of those have gone up, which is concerning.
Other questions?
We have a question from Kenneth Choi. Kenneth, if you could ask your question.
Yes, hi, Mike. Thanks for taking our questions. I was wondering, with Dr. Morrow questioning the ICU threshold before this latest stay-at-home order, has that complicated the messaging to the public and to the businesses out there about the stay-at-home order? And prior to this latest stay-at-home order issued by the state, which I know Dr. Morrow supports and has said that he would support it if the state issued it, were you trying to pressure Dr. Morrow into perhaps going along with some of the other Bay Area counties that issued the preemptive order?
No, not at all. I mean, Dr. Morrow really set out sound reasoning for this, which I agreed with personally, that there really is the necessity for balancing as we look at this disease and the impacts of it, not only on the health side, but the poverty side of it. in all that it impacts in, and really the marginal impacts that may have had closing down restaurants, barbershops, and beauty salons were, I don't know, and I don't think anyone can really tell how much of a spread is occurring there. But now that the order is in place, and we said all along, look, we've been following the state since May in every order that they've made, that we will certainly comport with the state's orders now and make sure that those businesses comply with the state orders. And we'll be putting that out. We'll be educating people on it, and we will be enforcing it. As we said, we always would be.
We have a question from the chat, Mike, from Margie Schaefer. Can you speak further about enforcement of the stay-at-home orders? What consequences do rule breakers face?
Well, it's the same that we've talked about in the past, and that's why we have the compliance team out there enforcing with businesses right now, to the extent that businesses that are supposed to be closed open, they will be cited and accordingly. And certainly we'll go through the education period. We'll go through the education process. We're going to try to talk to them about new resources as they hopefully come out from the federal government through the state for small businesses and all those folks that they employ. I mean, there is a trickle-down effect that a lot of people are going to be unemployed here in some of those, in the most vulnerable communities who work in these small businesses. So we've got to make sure that they're able to pay their rent, that they're able to provide for their families and have the necessities of life to get through this period of time. We know that we're going to be shut down for at least 3 weeks now in compliance with this order. And now it's really, as we have in the past, gone out and educated businesses to stay safe. Now we have to educate them as to potential resources and the fact that they do, in fact, have to close down now. And for any one of those, and we're going to send a clear message to any one of those who violate, they will be cited.
We have a question from Emily Miebach. Emily, if you could unmute yourself and ask your question.
Hi, Mike. Hi, Sarija.
Hi, Emily.
Hello. I was wondering if the county has any idea that, aside from gatherings, what's kind of the second way that folks are contracting COVID? Is it from going to restaurants, going to work?
Sarija, do you want to handle that?
Yeah, and I mean, just to drill a little, it really is, we see the vast majority, Dr. Morrow estimated more than 90%, and this is the data we're getting from our case and contact investigators, coming from small gatherings. And really it's because people do not know that they could be carrying the virus for a couple important reasons. Number one, more than half of the transmission is from someone who is asymptomatic. So when one doesn't know that they're carrying the virus and just carrying out activities of going over to someone's house for dinner. It could be a family member's house for dinner, or, gathering someplace. And then the second is because folks who are on the front lines exposed might come home to crowded households. That exposure is unknowingly passed on, in a household gathering. So it's just so important to help increase understanding of, at this rate, with this level of spread throughout our community, we all have to absolutely adhere to the state order that is being imposed, but also mask at all times, insulate our families by not mixing households. And some of us have big families, and it's just, we need to be extra protective, and we need to not wait. At this point, the public health supports are strained. And so some of what we said a month ago about go get a test and, answer that call from a contact investigator, that's still really important. But at the earliest sign that one knows they might be exposed, it's really important to self-quarantine, isolate yourself from others where you can. If you need support, you can access that support that the county has mobilized. But this is a concerning time these next few weeks, and this has to be a different type of holiday time this year. There's a lot of hope around the corner with the vaccine. If we can get through these next few weeks and months, there's a much brighter glimmer of hopefulness, that can await if we can bear down together to get through these tough weeks.
And we're just hoping that people adhere to that. I mean, that's very well said, Sarija. And the double celebration can take place next year, but this is just not the year for it.
We have a question from in the chat, and her hand is raised. Sierra Lopez, if you could ask your question, please.
Yeah, thank you, Mike and Sarija.
Sure.
In talking about our approach, our business approach and enforcement of health orders, what is the approach going to be then in getting the everyday public to abide by health orders? We know that the surge is occurring from gatherings. It's not these businesses. So what's the enforcement going to look like for, our everyday community members?
Well, we're going to prevail upon the goodwill of the folks of this county, like they have before, to really understand the crisis that we're in now. And you can't miss it if you turn on the news, if you look in the paper, if you look at our dashboards here, you can see the exponential growth that's going on. I think that now that circle is narrowing for everyone, where maybe several months ago, maybe you didn't know somebody that had COVID or got sick or died. And I think that has struck home with almost everybody now, and it resonates with everyone that someone, I think almost everyone probably knows somebody now, or a relative, a family member, or friends who maybe had a loved one pass away because of COVID-19. And as the reality is sinking in, we're hoping that people will understand that they have got to do their part. It's almost, Sierra, like speeding on a freeway. There's not enough police officers out there or highway patrol officers to enforce every single speeding violation that they see. But the vast majority of the people adhere to the speed limit. And we're prevailing upon people to do the right thing. It is, it will help. We know that. It has in the past. And we're going to just prevail upon the goodwill of everyone to understand how serious this is, and we cannot do it without them.
Is that
Thank you.
your final question, Sierra?
No, I wanted to ask an additional, thank you. So we know, a few weeks ago and maybe a month ago, Chief of Health Louise Rogers said that the main goal is to get our COVID cases as low as possible so that we can handle a surge. Did those efforts pay off? And is the severity of this surge what we expected?
Sarija, I think that's more up your alley.
Well, I think we're at a place today with the Bay Area joining most of the rest of the state. I actually didn't see the governor's press conference to know if the northern counties are also at the strained capacity that we are, that what we've known about the ecosystem in which we live and work has borne true, and the capacity is too strained for us to have any other alternatives other than the stay-at-home order. So is the case rate higher than we would have expected or wanted? Yes. This is a really concerning time. We haven't been able to mitigate the increase that began around the Thanksgiving holiday time. That is when we saw the case rate really start to grow at a much steeper rate. And, through unknowing exposure and passing on of the virus, this is not about blame. This is about understanding that we're at this point on this day in which we just have to get through in a different way, with everyone staying as close to home as possible. And we all have to be more limited in our exposure and in our movement, because the strains on the hospital capacity are too great.
And in regard to that, I think, Ms. Rogers also indicated that it wasn't a matter of if, it was a matter of when. I think we all knew that this day would come, though, I think there was a glimmer of hope for a while there that we might be able to thread the needle and avoid it. But clearly, It was something that we foresaw and that we knew we'd be here at some point in time, and here we are. And now we have to deal with it. It is severe, and we're just asking people to understand the situation we're in right now. We're maxed out on testing. The testing is only a point in time type of test. It's not something that's going to give you, with a clear conscience, the ability to go out and mingle with people and gather with people, or some kind of license to gather with people. It just says at that point in time your test was taken, you didn't have COVID-19. You know, you could have a half hour later interacted with somebody with it and have it. So it's just, that's the message we're just trying to reiterate, that everyone has to do their part in this, especially during this critical time.
There are no other questions in the chat, and no one else has their hand raised, Mike. So I think we've gotten all the questions.
Okay, listen, I just want to thank all of you, especially those who have been with us throughout this entire year. This will be the last one of the year. We're going to pick up again in January, that first Wednesday in January, I believe. And Connie, what's that date again? I'm sorry, I don't have it in front of me.
January 6th, Wednesday, January 6th.
January 6th. Great, thank you very much. And I just want to say to all of you, happy holidays. I know there'll be different holidays, but hopefully you'll find some type of joy. And know that, you know, there is a bright future ahead in 2021, and we'll all get there together. So thank you again for all you do, and we'll see you next year.
Thank you.
Bye-bye.